So, we're investing in improving public health care here in Manitoba, hiring physicians, recruiting nurses, healthcare aides, respiratory therapists, allied health professionals, everyone, support staff included. And we're launching a new layer of healthcare through services like medinav.ca. People talk about the emergency rooms and the hospitals. We're working on that. But today, using a digital health card or plastic health card, you can book an appointment to see a physician or a nurse practitioner without ever having to go to the waiting room. You can do that online. So we're bringing Manitoba healthcare into the modern era, but we are standing with Canadian values that are timeless. And so, very proud of our health team, and thanks so much to the physicians for joining us.
Thanks, Peter. Thank you so much, Premier, for those remarks. When we talk about recruiting doctors, it's so important that Manitobans know that we are actually talking about you. We are talking about Manitobans. And Manitobans are feeling the difference on the ground of more doctors being here in our province and in their communities. Our province now leads the country in same-day or next-day access to primary care. We have shorter wait times to see a physician, we have better continuity of care, and we know that having a provider who knows you and understands you or your family makes all the difference to you and your health outcomes. And that is why we are so proud to welcome U.S.-trained doctors to our province. As of this January, Manitoba has recruited 13 U.S.-trained physicians, and that is building on the 285 who have joined our healthcare system since we formed government. This is a record-setting and record-breaking number. This is a historic increase in Manitoba. And doctors are telling us very clearly why they're choosing our province. They want to practice medicine without insurance barriers getting in the way. They want less administrative overhead and more time with their patients. They want to make clinical decisions based on evidence, not interference. Here in Manitoba, we respect physician autonomy. We respect human rights, and we center care around patients, not profit. We've also done the work to make it easier for physicians to come to our province and to stay here. Last June, we approved changes to regulations to streamline the path for qualified U.S.-trained doctors to apply for full licensure in Manitoba. We've worked to make immigration and credentialing clearer, faster, and more supportive because we know that doctors are ready to practice and we need our system to be ready for them. The sharp contrast to the past is not lost on any of us. It was not that long ago, under the previous government, that doctors were leaving Manitoba. And today, we are actively recruiting them and supporting them to build long-term and rewarding careers here in our province. We know that physicians want to practice in places where science is respected, where patients are treated with dignity, and where healthcare is guided by compassion, evidence, and human rights. And Manitoba is the place for all of that. So today you're going to hear from one of those physicians, someone who has chosen Manitoba not only for a job, but for values that we stand for and the healthcare system that we are building together. It's my honor to introduce to all of you Dr. Jesse Krikorian. Thank you. Thanks, Jesse.
Hi, my name is Jesse Krikorian. I work at Clinic Community Health here in Winnipeg, and I'll apologize if I have to step out pretty soon. I've got patients to see around 10:15. But I did want to be here today and talk about my experience. After practicing in the United States, working in a publicly funded healthcare system has been a big shift for me, but in the best way. Here, care is based on need, not what someone can afford. In the US, it wasn't unusual to have patients who needed sooner follow-up, but who just couldn't afford to come in to see me. And that's a hard thing to carry morally as a physician. What I appreciate most about practicing in Manitoba is being able to focus on patients. I'm not spending my lunch hour on the phone with insurance companies anymore, and I can actually use that time to care for people. The recruitment and licensing process also made a real difference for me. I felt supported at each step, from immigration to getting licensed and settled in. There were people I could call for any questions I needed to ask, and I didn't feel like I was doing it alone. When I came to Winnipeg, it felt incredibly welcoming. This is a place where I can practice medicine with professional autonomy, without interference, while enjoying a really good quality of life. For physicians in the US who are looking for a change, especially those who want to focus on patient care and practice in a system that reflects their values. Manitoba is a place I genuinely encourage them to consider. I'm grateful I made the move, and I'm really glad to be here. Thank you.
Thanks, Jesse. That's great. Thank you so much, Dr. Krikorian, for sharing your experience and for choosing to work here in Manitoba. And to all the doctors here today, thank you so much for choosing to practice here in our province. We're now going to open up the floor for questions from the media. Thanks so much. So all of these doctors have come to Manitoba as a result of the Healthcare Recruitment and Retention Office. So we stood that office up, oh goodness, now it was May of last year. And we have seen a remarkable amount of work done by the Retention and Recruitment Office to retain, first and foremost, but certainly to recruit doctors and healthcare providers from all over Canada, from outside of our borders, obviously. So these 13 doctors are a direct result of the Retention and Recruitment Office efforts.
Do you know if that's 13 net new doctors from the States, or have we lost any to the States? Are you keeping track of net?
That's 13 net new doctors from the United States, and I want to be clear that's above and beyond the 285, that record number of net new doctors in Manitoba. This is 13 additional physicians.
And how about doctors from other provinces coming to Manitoba? Do you have a net increase or a number on that?
We do have a number on that we can get you offline, Carol, but we are continuing to see doctors choosing Manitoba first. So under the previous government, Manitoba was really a flyover province. We knew that, and we heard really clearly that folks were choosing Manitoba last. And what we've seen is that there's been a real shift. Manitoba has become a first choice and a first stop for doctors and healthcare providers. We just 2 months ago, we're talking about the 6 healthcare providers, the 6 U.S. trained doctors that were here in Manitoba. We've more than doubled that very quickly. So Manitoba is becoming a first choice and a first stop, and we want to make sure we keep doing everything we can to maintain that momentum.
Your office also said in around October, around 33 the province had been talking to. What's the number at now?
We're talking to dozens of doctors right now from the United States and from overseas, from the United Kingdom. And so our Retention and Recruitment Office, which is very important for folks to know, the efforts are being led by doctors. The best people to recruit doctors are doctors themselves, and we work with some wonderful physicians who are doing that outreach and building those relationships. So right now we've got a number of physicians from the United States who have interest. We're in the process of recruiting here successfully. Also have doctors, like I said, from the United Kingdom.
Of those 13, is there a breakdown on where they're practicing here in Manitoba?
We can get you that. Oh, we can get you that as well. There's some folks who are working in primary care, some are working in specialized areas as well. We are going to continue to welcome all providers, all doctors who want to join the front lines here in Manitoba from the United States. Our community, our province is open for you. We're welcoming doctors who want to call Manitoba home and practice healthcare without any barriers or worrying about ideologies. We want them to focus on patient care, which is what they do best.
Can you bring us through the process? You're practicing somewhere in the States. Did you hear about Manitoba or how did Manitoba come to your attention?
I was looking for opportunities outside of the U.S., and so I was looking at Canada. I looked at a few different places, but I found this position at Clinic that seemed like a really great fit for me, and so I decided that Winnipeg would be it. I started my process and started looking in January, and then I came over in late summer. It was definitely quite a few steps to get here, but there was great support from both the Healthcare Retention and Recruitment Office and also from Doctors Manitoba for making that shift. But I'm very excited to be here in Winnipeg. It's just a little bit colder than I'm used to, but not by that much, so I'm managing. Most recently, Michigan. Yeah. Yes, so I moved in large part because I saw the increasing government interference in care. And I do community health, so I focus on underserved populations, and that includes LGBTQ plus populations. So I saw sort of the writing on the wall that that was going to become more and more difficult to provide quality care to those patients. And I am really passionate about being able to provide care to the people who need it most. And those are some of the folks who do need it most. So I wanted a place where I could operate without government interference, where I could be an autonomous physician providing evidence-based, high-quality care to my patients, and Canada fit the bill. Yes, I have heard from a number of my peers who are interested in Manitoba. I've heard from also a number of other nurses, nurse practitioners, CNAs, people all throughout the medical hierarchy who are interested in Manitoba. And I've been reaching out and getting people a little more information about Winnipeg, trying to get Manitoba on the map for more Americans.
Okay. Yeah, for sure. Excuse me, I'll just step up to the mic here. Ben, à cause du bureau de recrutement dans le système de santé, nous avons accueilli 13 médecins des États-Unis. Et pour nous, en tant que votre gouvernement, c'est une opportunité de promouvoir les valeurs canadiennes, soit d'avoir un système de santé universel ou juste d'être un pays qui accepte tout le monde comme ce qu'ils sont. That's up to you guys.
I'm Canadian.
Yeah.
I'm from
They're
Winnipeg.
already here. Yeah, so
But I still support the effort, for sure.
there you go.
Yeah. So when we came into office, the wait time for Family Doctor Finder was really not where it needed to be. So the match rate was actually quite low. And so we set a target for 80% of those folks who use Family Doctor Finder to be matched within 30 days. And we hit that target actually many months ago. So if you use familydoctorfinder.ca, you can get connected to a family physician or a nurse practitioner or primary care provider in under 30 days. And we're seeing great success with that. What we also know is that here in Manitoba, we are leading the country now in being able to access primary care the same day or the next day. And medinav.ca is a big part of the reason why. So you can take your plastic or now digital health card, you can go to medinav.ca, make an appointment the same day to see a nurse practitioner or doctor. And we're seeing from Manitobans very clearly that has changed the game for them and their health care. Your kid gets hurt at hockey, go to medinav.ca after the hockey game, and you can get your kid the care that they need. You're not waiting in an ER, you're not waiting in an urgent care. So, doctors are very pleased with this service. Manitobans are over the moon about this service, and we're going to keep welcoming more doctors to this province from the United States and elsewhere so that we can continue to build medinav.ca and build better access to primary care. What we know is that when you starve a healthcare system, when you cut services, when you cut healthcare workers, it does massive damage. We saw that, and it takes time to repair that damage. That being said, Manitoba has never seen this kind of recruitment and retention effort and results that we're seeing now under our administration. So we have record numbers of doctors and nurses joining the front lines of our healthcare system. That means Manitobans are getting access to primary care faster in this province than they have before. People have more tools to access primary care in this province than they have before. And so the impact of that in terms of wait times in urgent cares, EDs, that's going to take some time, right? But what we do know is that Manitobans are finally getting access to the kind of care that means they no longer have to go to ERs, urgent cares for primary care. They're no longer going to be getting sicker and sicker and sicker because they don't have a doctor. And so every single one of the doctors we've recruited here from the United States is invaluable to how Manitobans are going to access care in our province. As of this month. January, since the last 2 months. So six doctors were net new from the United States a couple of months ago. We've more than doubled that, so that we're at 13 now.
Total.
Total. Correct.
The 285 were all American?
No, 285, that would be
Yeah.
incredible, but yeah, that'd be a lot of American doctors. The 285 are the net new doctors we've recruited since we became government. Yeah, you're welcome.
Sure. No, we haven't. We're starting to work on the location, and we'll be ready to go once we get the regulatory pieces. I think the minister was meeting with some neighbors as recently as yesterday and just keeping them up to date, but also listening in terms of are there things around security or other measures that could help address, you know, the different things that they're thinking about. Yes.
Well, I have all my colleagues in Montreal are texting me about that video you published yesterday about the Crown Royal. Is that just poking fun? What's your message to the board?
You know, Crown Royal is a Canadian whiskey that's made from the waters of Lake Winnipeg right here in Manitoba. It employs tons of blue-collar folks, the type of people who elect both Premier Ford and myself. And we need to stand up for their jobs. So I'll be seeing Doug next week when we get together with the Prime Minister and the Premiers. And I'm just encouraging him, you know, for sure we don't want to see Crown taken off the shelves in the LCBO. So maybe there's another path forward here. And, you know, maybe he can register his displeasure in other ways. Of course, I support the Ontario workers too, but there are Ontario workers who work at a different canning facility, right? And so whether it's them, the folks in Gimli, Manitoba, les travailleurs au Québec qui travaillent pour Diageo, il y a beaucoup d'effets. There's a lot of impacts that we'd see. Oh, that was my attempt to do it in French right there. OK. Le message à M. Ford est qu'il y a beaucoup de travailleurs et travailleuses ici dans le Manitoba, à Gimli, même à l'Ontario et puis aussi au Québec, qui sont des Canadiens et on ne devrait pas lutter contre eux. Alors, je le demande de trouver une façon qu'on pourrait travailler ensemble pour avancer le Team Canada, mais en même temps, peut-être il y a des autres méthodes qui pourraient exprimer ses pensées au sujet des changements. Non, 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 non. Monsieur Ford et puis moi-même, nous sommes toujours en contact au sujet des politiques ou des différents enjeux, ou même juste des Leafs et des Jets. Je suis déçu que ce n'est pas le Canadien, mais c'est la vérité. Et puis, on va continuer de travailler ensemble. Et ça, c'est un message important pour tout le pays. C'est que nous sommes capables d'avoir des différentes idées sur certains enjeux, mais continuer d'appuyer notre pays et de travailler ensemble comme des Canadiens. L'autre sorte des Canadiens.
We're here. The ABC has reported that SCOs parted ways with another CEO. And I just wondered if that's anything that the province is concerned about, just because we have so much money that we've invested or have provided for them to rebuild the bank.
You got me. You caught me off guard here, Carol. I have not even heard a rumor about what you're talking about. So maybe we can circle back later once I get the info.
And just one other thing, you said that the Crown Royal was made from the waters of Lake Winnipeg.
Uh-huh.
That's for real? You didn't say that. Just the waters of Lake Winnipeg are known for their potability.
Well, I assume they like run it through some advanced filtration and like they probably boil it. Lake Winnipeg is beautiful. You know, some people in their rush to make a legitimate case about the environment get too worked up and actually cause negative reputational damage to Lake Winnipeg, which is still a very vibrant lake that sustains a commercial fishery, that sustains tourism, that sustains cottage country in many locations, not just Gimli, but also, you know, the beaches on the other side of the lake and elsewhere. So, yeah, I love Lake Winnipeg, I love our province, and I love the workers here. Manitoba's healthcare system is better than it's ever been. We have more staff working today than ever before. If folks are pointing to a different era in Manitoba healthcare, well, I would say that not all Manitobans had access to healthcare in those previous eras. So this is the most inclusive, most staffed up, strongest Manitoba's healthcare has ever been. The challenge is, after 2 terms of PC cuts, during an era in which everybody is dealing with the mental health impacts of the pandemic, and amidst an aging population, and a population with unique and complex medical needs, either related to diabetes or MS or other things that we see in Manitoba, there's a whole heck of a lot more that we need to do. Everybody recognizes that we need to move away from working with agency nurses. I thank the world of Uzoma for taking these steps. We're always going to respond to the needs of a community anywhere in Manitoba to keep their local emergency room open. Where the PCs closed emergency rooms, they closed the Victoria emergency room, they closed the Concordia emergency room, they closed the Seven Oaks emergency room. We open emergency rooms. We open Carberry, we're working on Ericsdale, the Vic ER site prep is happening this month. And what I'd say to nurses who are working for agencies is I just encourage you, first of all, thank you to every nurse who works in Manitoba. You do amazing work. But I encourage you to leave the agency and come join the provincial travel team. I think what I've heard from nurses about why they've left for agencies was, first of all, just hating the former government, but then also work-life balance, wanting to find more control over their lives and the flexibility to choose your shifts, but also higher incomes. Great. That is what you can have with the travel team. You can choose which shifts. You can choose the work-life balance, the amount that you want that's going to work for you. And we'll give you the competitive wage. Plus, it's better for the healthcare system because we're not paying the profit margin that goes to these agencies, which means if you're a nurse who's thinking about nurse-to-patient ratios, you're thinking about workload, if you are doing the same amount of work under the travel team as opposed to the agency, you'll have more support at the bedside if you work as part of the travel team. So yeah, we're flexible. We're always going to be responsive to the needs of the healthcare system, and we're going to keep building this thing up because we know healthcare is your #1 priority. And we'll go to Zoom.
Thank you, Premier. 2 reporters on Zoom. La première question and 1 follow-up. Oceane Croissant, Radio Canada.
Did you just say croissant?
Question. Nice to meet you. So, yes, my question is, like you said, you want Manitoba to be truly bilingual, and like, how do you plan to do that for the medical field? And like, my question is, how many of these doctors, of these new doctors, speak French?
Des États-Unis, je ne sais pas, but est-ce que tu parles français? No? Okay.
Oui, oui.
You speak French? No?
Oui, je
Okay.
parle français. La réponse en français, si possible.
Oh
S'il
non,
vous plaît.
j'étais en train de demander les médecins si ce qu'ils parlaient le français. Mais, ben, je dirais que oui, c'est toujours une priorité dans le système de santé. Puis, un des médecins engagés avec cet enjeu le plus capable et puis de mode le plus souvent est José François. Alors, il est le directeur dans le Shared Health, mais il est aussi engagé avec le recrutement. Alors, avoir un francophone dans ce rôle, ça nous donne une voix pour appuyer cette priorité. Et puis, au même temps, au niveau de la francophonie, Nous avons reçu une réponse de l'Organisme international de la francophonie. Le Manitoba a demandé si ce qu'on pourrait participer comme le sens d'observateur. Ça, c'est un niveau plus haut que jamais. Ils ont répondu oui. Et alors, je remercie le gouvernement fédéral, les autres gouvernements provinciaux qui nous avons appuyés. Et puis, nous travaillerons avec l'OIF pour avancer ces prochaines étapes au but d'avoir une présence cet automne aux prochaines rencontres de la francophonie mondiale.
Did you have a follow-up?
Oui, merci. Donc, ce que vous dites, c'est que à l'automne prochain, l'arrivée de médecins francophones sera discutée.
Ça, c'est une rencontre de l'Organisme international de la francophonie, alors c'est-à-dire tous les enjeux mondiaux. Oui, le système de santé sera une partie de ces discussions, mais vous avez demandé ce qu'on fait pour créer un milieu plus bilingue ici dans le Manitoba. Participer dans l'OIF, c'est un de nos buts importants pour promouvoir la francophonie ici dans le Manitoba, mais aussi lancer un message tout partout dans le monde que oui, il y a beaucoup de francophones dans l'ouest du Canada, il y a beaucoup de francophones tout partout dans notre pays.
Et je parlais de la francophonie, mais du coup au niveau médical.
Oui, et puis j'ai déjà répondu à cette question.
Merci.
Merci à toi.
Okay. Our next and final reporter from the Globe and Mail, Timur Durrani. One question, one follow-up.
Hello, thank you so much for taking our questions. My questions are for Premier Kinew. Premier, I'm so sorry to do this, but I'm going to have to switch subjects a bit on a different topic that I was hoping you could please comment on for us. We're working on a story at the Globe and Mail about the behind-the-scenes work that has been happening between Canadian provinces and the federal government in the wake of U.S. President Donald Trump's tariffs on nearly every country in the world. We've been told repeatedly since last year that lots of changes have been made toward better communications and coordinated planning between Canadian jurisdictions. And I'm hoping you can expand on that for me from Manitoba's perspective. I'll use both my main question and follow-up question for this. So my first question is, in between the First Minister's meetings, who in Manitoba has been making sure Ottawa is kept abreast of your province's perspective, particularly on these trade issues? And is this the same person that then makes sure provincial leaders, such as yourself, Premier, are conversely aware of Ottawa's perspective?
Well, it starts with me, and I have an open line of communication with the Prime Minister. So leading up to his trip to China was definitely letting him know about our priorities, which, as you would expect, are in ag on that front, canola and pork in particular. Following his remarks in Davos, which I think the vast majority of Canadians heard, I reached out to let him know that his message certainly resonated with people in our province and across the country. So yeah, I think it starts at the top. We have excellent people at the ministerial level, in the civil service, who are engaged at every level with the federal government, with the other provinces. And I think it's a good time for Canadian cooperation.
Okay, as a follow-up, Premier, the reason why we're asking this also is, because Ontario, of course, your friend Doug Ford, had lots to tell our Globe reporters about how this framework was sort of handled, this coordination stuff, with, Canada's recent EV deal in China, which he had some issues with, as you know. So that's kind of why we're asking these things as well, because, of course, he characterized the tone of these briefings apart from, say, the Premier talking to the Prime Minister and people behind the scenes, even that sort of not happening maybe as much. So I guess my follow-up question with that in mind is, how would you characterize the tone of these federal provincial briefings in your perspective? And do you think Ottawa is doing its part to make them happen often enough in between the First Minister's meeting, say, next week? Is on an unofficial sort of capacity, things that, we won't have a reporter's, press conference after talking to you with the First Minister's meeting. Are you thinking these briefings are happening enough? That's sort of what I'm hoping you can tell us, your staff and his staff, Mr. Carney's staff, do you think they're talking enough? Do you think they're getting enough of each other's perspective? What's sort of different here?
Well, there's always room for improvement. And when you have a project like Churchill, which is literally the solution for Canadian freedom and being able to defend our presence in the Arctic, that's the solution for taking our economic growth in the West, which, let's be clear, is responsible for a huge chunk of the Canadian economy. And you're just talking about lifting up the quality of living for some of the poorest Canadians out there. Churchill is it. So, I mean, there's always more that we could talk with the federal government about how to work together on that. It's not my role to explain the federal government's approach, but I would say personally, when you're talking about a trip to China, I recognize I'm not going to get real-time updates while Canada's delegation is there. And that's just because people don't bring their phones when they're traveling on official business. So I think that situation might be a little unique. Overall, I'm encouraged by Mr. Carney's level of communication so far. And we did get an update relatively soon after they made that announcement, like within hours, with the EVs and the canola and all that. So there's a lot to work through, just as there is with Mr. Ford on the Crown Royal stuff. We don't have to agree on everything in order to do the big things together. And so on the federal side, we still want to see an off-ramp for the tariffs applied to our pork products. Pork, you're talking about billions of dollars to our Canadian economy that's coming out of Manitoba. Manitoba generates billions of dollars a year through our pork sector. We love doctors, we love healthcare. How do you pay for it? Pork is part of it. So is mining, so is energy, so is manufacturing, so are so many other sectors of the economy, including the service sector. So we got to work together. And by the way, those workers at the Crown Royal plant in Gimli help to contribute to our healthcare and our education and our Canadian economy as well.
And that's everything from Zoom. Thank you.
Okay. All right. Thanks, everyone.
Thanks, folks.
That's great.
Thank you, Dr. Smith.
Yeah. Thanks so much.
Really appreciate it.